Have you ever wondered what really goes on inside a therapist's office? I mean, beyond all the cliches, there's this hidden craft, right? A set of skills that are learned through some seriously intense practice and a lot of high stakes moments. Today, we're going to pull back that curtain using the amazing book Becoming a Therapist as our guide. We'll follow the journey from a nervous beginner to a seasoned pro, starting right from the very beginning. So picture this. You're a brand new therapist. In just minutes, you're about to meet your very first patient. The office is totally silent. What do? Well, Dr. Suzanne Bender, in this exact spot, she wasn't cramming medical charts. Nope, she was rehearsing for an audience of one, an empty chair. You can almost feel the anxiety, can't you? Practicing her posture, her tone of voice, even where to put the box of tissues, all for an empty chair. It just perfectly captures that universal fear we all have of a first impression, especially when the stakes feel impossibly high. And that's the real challenge, isn't it? I mean, you can script the perfect introduction, but then what? What comes next? For Dr. Bender, the answer was, well, nothing. Silence. She was completely tongue-tied. And this really gets to the heart of therapy. In a job where words are your main tools, what do you say? And maybe more importantly, why do you say it? This is where you really see how precise those tools need to be. For example, saying you certainly have trouble dealing with your husband, that kind of lands like a judgment, right? But what if you just rephrase it to, your relationship with your husband seems complicated? That opens the door. It invites exploration. It's such a tiny shift in words, but it completely changes the entire dynamic. That's a crucial early lesson for any new therapist. You know, the pressure was so intense, she actually fantasized about having a secret lifeline, a walkie-talkie straight to her mentor, Dr. Messner, for live advice. You can just picture it. Dr. Messner, come in. She's not talking. What do I do now? And while that's a pretty funny image, it really shows you that desperate need for guidance and introduces this vital mentorship that's at the heart of her whole story. Okay, so after all that internal rehearsal, what happens when the patient actually shows up? We're moving from the therapist's inner world to that very first interaction. And you might think saying hello is the easy part, but in therapy, even that simple greeting is an art form with incredibly high stakes. This anecdote is just so powerful. I mean, imagine being that priest. You're struggling with your vow of celibacy. You've come seeking help dressed as a civilian. And just like that, your identity and your reason for being there is exposed to a whole room of strangers. In one seemingly innocent greeting, all that potential trust is just shattered. Confidentiality, which is the absolute bedrock of therapy, it starts before the patient even walks into the office. So what's the solution? Well, Dr. Bender learned what she calls introduction gymnastics. It's pretty clever. You don't call out the patient's name. Instead, you walk up to the person the receptionist pointed out and you ask, "Excuse me, who are you waiting to see?" And only when they say your name do you introduce yourself. See? This way, the patient is the one who reveals the connection, never the therapist. Now, at first, Dr. Bender hated this. It felt like a social straitjacket, just awkward and totally unnatural. But then she started to see it like learning a new sport. You know, the moves feel weird at first, but they are absolutely essential to play the game well. And in therapy, that game is all about building a foundation of absolute trust and safety. All right, so once the patient is safely in the office, the real work begins. And it's not just some unstructured chat. Before you can truly help someone, you have to understand them. This is where the whole consultation process comes in. It's a structured way to build a deep, comprehensive picture of the person sitting across from you. In a world that's all about quick fixes, psychotherapy is deliberately slow. There's no take 2 of these and call me in the morning. Nope. Instead, it demands patience and a really thorough consultation to map out all the complex forces at play in a person's life. Only then can you start to make real progress. And this case really shows why that slow, thorough approach can be, well, life-saving. Dr. Messner was treating a lawyer for what seemed like panic attacks. It would have been so easy to just focus on the psychological stuff. But a full medical history revealed that the man's father had died of a heart attack at 46. And suddenly, the symptoms of chest pain and shortness of breath took on a whole new, terrifying meaning. The most important first step wasn't therapy. It was an urgent call to a cardiologist. So what does this deep dive actually cover? Well, you can think of it as a review of systems for the mind, and it is incredibly thorough. It covers not just your personal medical and psychiatric history, but your family's history too. It maps out your entire psychosocial world, from work to relationships. Every little piece is a clue, helping the therapist understand the whole person, not just a set of symptoms. But here's the thing, therapy isn't a checklist. It's a dynamic human process. And with that comes all sorts of complex behaviors and really tricky situations. So how does a therapist navigate these kinds of therapeutic dilemmas? Let's take a classic one. A patient is consistently 10 or 15 minutes late to every session. It's easy to get annoyed, right? To see it as just a logistical problem or maybe a sign of disrespect. But in therapy, everything has meaning. The goal is to translate the action, the lateness, into words. It's not just an annoyance, it's a message. Is the patient trying to put off an intense session? Are they maybe expressing anger that they just can't say out loud? Exploring the meaning behind the lateness, that's where the real therapeutic work starts. But some dilemmas are far, far more urgent. What about one of the most serious situations a therapist can face? An emergency call after hours from a patient who is actively suicidal. The weight of responsibility in that moment is just immense. Dr. Bender shares this really profound wisdom from her mentor, Dr. Messner, after she herself had to go through this struggle of a patient's suicide. His advice wasn't some technique. It was permission. Permission to slow down, to be thorough, to trust your gut, and to keep asking questions until you are absolutely confident in your decision. Because in that moment, a patient's survival could be at stake. So once that foundation of safety and history is built, the therapy can move into much deeper waters. The conversation evolves, and the relationship between the therapist and patient, well, it isn't just the setting for the work anymore, it becomes the primary tool for healing itself. A key concept in this whole process is something called transference. It's basically when a patient unconsciously projects feelings about someone from their past, often a parent, right onto the therapist. So they might react to you as if you were their critical father or their distant mother. The therapy room essentially becomes a kind of laboratory where these old patterns can be explored as they're happening in real time. This leads to a really powerful shift in perspective. When a misunderstanding or a conflict happens between the therapist and the patient, it's not a failure. It's actually a golden opportunity. For a patient who's terrified of rejection or avoids conflict at all costs, successfully navigating a disagreement with their therapist can be a profoundly healing experience. It teaches them that relationships can actually survive ruptures. And this brings us to the ultimate goal. Dr. Bender realizes the aim isn't perfection. Being this all-knowing therapist who never makes a single mistake, the real goal is to build resiliency. It's about fostering the capacity for relationships, both inside and outside of therapy, to not just survive challenges, but to grow stronger because of them. So, is being a good therapist some kind of innate talent, or is it a learned craft? What we've seen today really suggests it's the latter. It's a journey from anxiously practicing in front of an empty chair to confidently navigating life's deepest challenges. It seems to be less about having magic answers and more about mastering a deeply human and highly skilled craft. So how does knowing that change the way you see the process? Thanks for joining us for this explainer.